It's time for New Wellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good morning and good day, everyone. And thank you so much for tuning in to another wonderful show on New Wellness TV and radio, where you can see us live on your YouTube channel. You can also see us at UBN Go. You can see us at and listen to us at iHeartRadio. I'm so happy we made it to iHeartRadio. I want to thank Tony Sweets here at the studio for making that happening a year ago. I was so excited when I received my letter that we're also at iHeartRadio. But I want to say that we have a very interesting show only because it isn't a day. It really isn't a day that does not pass that someone doesn't call me, either themselves or a family member that is suffering from pain. So the title of our show is Pain-Free 45 Minutes with the Tesla Max. And my guest today is the one and only, the renowned Gregory Westfall. Thank you so much for being here.
Wow. I've got to get one of those auto applause to use around the house here when I make
That's not an auto
jokes.
applause. That's people right here. You just don't see them.
Yeah, that's probably the only way I'll get the kind of laughter. I laugh at my own jokes, so at least I have that. Dr. Lee, it's such a pleasure to be here with you. I'm up in Sandy, Oregon. We have a foot of snow outside, and we're cozy and warm inside.
Yes, you look nice, cozy, and warm there. Yes.
So up here on the wall behind me are two of my mentors, Abbott and Costello.
Okay.
I've been accused of doing the work of three men, actually, many times.
You were accused by whom? Your children or your wife?
Well, co-workers often.
Okay.
Unfortunately, those three
I
men
won't get
are
into that 'cause
Curly,
that
Moe,
came out a
and
little.
Joe.
Okay. Okay. I am so excited. We're going to jump in because you are a wealth of information. And we're going to be discussing from pain-free, from urinary incontinence to building up muscle mass and some of the wonderful people you have worked with, which I actually know quite well, and I'll be with him in March, Dagato. But I just want to say that we're going to start off first talking about a little bit about you and how did you get into this business that you're in, dealing with the Tesla Max, and how long has it been around? But first, tell me about you.
Well, thank you for that. I am struggling right now because my son just turned 40 years old. He's a doctor up in Yakima, Washington.
Yes.
And Dr. Lee, I don't know how that's possible because I'm only 39. So I'm still trying to figure out how that happened. My Lady Sunshine and I have 5 kids, 10 grandkids. And when I think about what I'm devoted to, whether it's family or to live a life of standards that I could be proud of at the end of my life, what are people going to say about me?
Yes.
And if I can reduce suffering from one person, just by what I've learned, and follow the lead that I've seen you live in your life, your devotion to positivity and unity and love, praise, and gratitude, then my life will have had value. I remember when I was trying to decide, when my beautiful wife helped change me from the barbarian I was into someone who wanted to provide for his family so he could raise a beautiful family. I began looking for a career, and I studied the book by John Nesbitt called Megatrends. Remember that book?
I remember hearing about it, yes.
He listed 10 different megatrends that were coming in the future. And so I chose a career in 2 of them, figuring I'd have a belt and suspender strategy. And those 2 were computers and healthcare. So I got involved in computerized healthcare.
Okay.
And of course, this was before the internet. So we had no idea how computers would take over our lives. They were supposed to simplify our lives, but they've made them more complex. The stresses that people are under, mental stresses, trying to keep up social media, etc.
And the Wi-Fi that's going up now, we have the what is it, the 5G, and so we're going to really have to watch our health when that 5G hit.
Our brains are under attack. It's not just our brains, our bodies, but we have forced vaccinations now in order to keep our kids in school. Without any safety tests, according to the suit by Robert F. Kennedy, the substances that are in these vaccines, if they were in your building, you have to put up a plaque in California to meet the law. But if you inject them straight past the immune system into the bloodstream, that's a whole nother story.
Yes,
but it's not just the things injected into our bodies and the food and the glyphosate in the food,
and environmental, of course,
Roundup and other things. But our brains are under attack from bombardment from, like you mentioned, 5G now. And when they first went live, they're about to launch 20,000 new satellites, and we're basically microwaving our brains everywhere we go.
But that's going to be another show, and we want to get into the pain because we have so much to cover, and I know we can do a part 2 on a show and come back to a lot of that. I'm not trying to cut you off because
no, please guide me. I do get off on tangents, but it's important for us to note that pain, where we are sensing it, is one thing, but the pain the brains are going through, we're not aware of this sense of foreboding and this sense of being under attack, but it actually leaves signatures on our autonomic nervous system.
Yes, it does.
And that would be a great subject for another show because we have to protect ourselves from this.
And I've had a show on the autonomic nervous system too, but we'll talk about that on another show as well. Okay.
Yes, ma'am. And now you've asked me to speak about the physical pain that we endure.
The physical pain, we know there's a lot of emotional pain, and it's all attached. You just can't take out one without dealing with the whole person. When there's pain in the body, there's pain in the body for a reason. It could be trauma, but then how did the trauma happen? You know, we have to really go into the whole history of the word pain. And that's what you're going to be doing for us today. And in talking about pain, we discussed some things on the way here when you were telling me there's good pain and bad pain, which we know. And then the same thing when we look at the skin for color and redness, there's things. So what is pain? And that's what I'm going to have you start with.
Well, most people think of pain as an enemy. But if you lived a life where you felt no pain, bad things would happen. A friend of mine in New York, her mother had neuropathy and numbness in her feet, and she got cold one winter and put her feet up against the heater and cooked them like a chicken in the oven because she couldn't feel.
Yes.
So the pain actually is our friend. It's sending us feedback that something's wrong. Yes. But in our society, we take the batteries out of the alarm while the fire is raging. It's almost as if the firemen show up to the fire, the scene of the crime, and they spray the fire hose on the alarm that's going off instead of putting the fire hose on. We take so many pain meds, they destroy the mucosal lining of the gut, and they cause systemic inflammation and gut permeability, which is another show we should talk about. And then the side
effects and, being addicted to it. And this is now, we're dealing with CBD now, but we'll discuss that later as well.
So we end up in our business dealing with the cause of pain, but these pain meds that people take and the prescriptions that people are on we know the side effect of one drug, but we don't know the cumulative side effect of these cocktails of drugs that people are on. There's no way exponentially to know. Some people are on 5, 10, 15, 20. One lady was on 27 drugs. And even JAMA has written articles about systemic toxicity, the inflammatory condition. But many of these pain meds and non-steroidal anti-inflammatories, we call NSAIDs, actually destroy the mucosal lining of the gut, so that we're mixing what I call the brown river from the mouth to the anus, a sewer. It's not designed to mix with the red river, our bloodstream, with all those billions of villi and microvilli in the gut, all lined with capillaries. When we destroy the mucosal lining with these pain meds, we end up with our immune system under constant attack.
Yes.
And these inflammatory conditions have side effects where your immune system is now attacking your joints. We know as we age, we lose lean muscle mass, and it's like shock absorbers. Pretty soon your axle's pounding on the pavement because your shocks have worn out. In this case, it'd be your lean muscle mass supporting your knees. But when people get pain anywhere in the body, Dr. Lee, we've found consistently it's almost always associated with a muscle strength imbalance. For example, the motocross riders who are gripping the handlebars on a motorcycle use their flexors for 5-hour race, and they have to pry their hands off the handlebars because they never use the muscles that open up their hands during that entire race.
Exactly.
And they create an imbalance. We see the tennis player who's always gripping ends up with an imbalance between his flexors that grip and his extensors that open up his hand. And he ends up getting pain in the elbow, tennis elbow, they call it. And we simply treat that by treating the extensors that open up the hand rather than treating the flexors that cause you to grip. Now, we have this series of opposing muscles throughout the body. You've got your tricep that makes your arm go straight, and you've got your bicep that makes your arm curve. And when we find imbalances, it might be across the spine bilaterally, or it might be between those two opposing muscle groups throughout the body. We find whether it's knee pain or hip pain or back pain or shoulder pain. Let me give you an example. Shoulder pain. Often, if people do push-ups, their range of motion and shoulder pain gets worse because their front side of their shoulder girdle is stronger. So we can identify these imbalances and work the weak side and correct the imbalance, and the pain goes away.
You know, not to cut you off, but you worked on my grandson when I first went through my training with the Max Pulse to have it in my office, because he had scoliosis. And you worked on the weaker side of his spine to help balance things off with his scoliosis, and it was amazing.
Well, the scoliosis often comes from kids wearing backpacks, for example, where they'll create an imbalance. It might be because we're not symmetrical. We have a liver on one side, forming the access room from the liver to the heart, and we have certain we run the mouse with our computer with one hand. We hold the baby in one arm while we do the heavy lifting with the other arm.
Yes.
Now, if you look at a scoliotic event, the muscles on one side of the back, if you palpate them, are hard as a truck tire, and the other muscles are weak and spongy, full of edema and atrophied muscles. And this creates a scoliotic event where the muscles in spasm, the strong side that are doing the heavy lifting, they go in spasm and involuntarily contract and pull the spine crooked, like a tightened string pulling on a bow.
Right.
So what we have to do is release the spasm, and you can actually see the spine straighten in many of these conditions, depending on how early you intervene. But it's not enough to relax the spasms. You have to ask yourself, why is this in spasm? And there's almost always the strong side that goes into spasm to get our attention. It's complaining. It's saying, how come the other muscles on the opposite side aren't doing their job? Why am I having to do all the heavy lifting? Now, this doesn't just happen with scoliotic events in the spine or with the shoulder, where we will strengthen the backside of the shoulder, correct these imbalances, and the pain goes away. In this case, pain is our friend. It's feeding back information to us that something's wrong here.
Yes.
When people have constant pain in the hip, we've had people scheduled for shoulder surgery doing push-ups without pain in 2 weeks after starting our protocol, a 6-month take-home treatment protocol.
It's absolutely phenomenal, yes.
They can come into the office, and you mentioned Nick Delgado, the current world record holder, strength endurance champion, and weight curled and lifted above his head in 1 hour. And he has, on video, I'll send this to you, stated that the Tesla Max is the greatest exercise on the planet. He can target any muscles, and it's his secret weapon. Here's a guy, 170 pounds, regularly beats guys twice his size and a third his age. And he's using the Tesla Max technology intelligently. But keep in mind that things like incontinence with the deep pelvic floor muscles that atrophy, you can target those muscles if you're a female. 55% of ladies over over 65 have leaky
Urinary
pipes, very
incontinence,
short
yes.
urinary tract.
Mm-hmm.
The deep pelvic floor muscles get weak and muscles go into spasm. In that case, it pulls the sphincter apart. And every time you laugh or play with the grandkids or run, people are having accidents, and they don't want to end up their life in diapers when they started in diapers. So often they become captive in their own home.
Mm-hmm.
And
Mm-hmm.
this can be fixed by targeting and strengthening the deep pelvic floor
and
muscles.
We have a spokesperson for that. I don't have her pictures with me today, but we have a spokesperson who actually have corrected hers. And I know she doesn't mind saying, because she is our spokesperson, and that's our former Congresswoman Diane Watson is our spokesperson for women with urinary incontinence. And it's just amazing. You can do Kegel exercise, but this machine is going to take it to a whole nother level of doing your exercise there. So it's really
well. I was
important.
honored to meet the Honorable Congresswoman Diane Watson with you, and she actually shared with us. She had great courage that you first treated her knee and the knee pain that she had, and she
And
had
also the
remarkable.
peripheral neuropathy that she
Yeah,
has gone.
you're treating her neuropathy,
Yes.
but Dr. Lee, haven't you also had patients who are scheduled for amputation?
Yes.
And you used the Tesla Max on the wounds on their feet and
Mm-hmm.
canceled the amputations for those patients?
They canceled the amputation because we could see the doctors told them they had no circulation. They had a pedal pulse, the pulse on top of the foot. I could feel it faintly, but the foot was so it was charred. It was almost like someone had set her feet on fire. And when I put the Tesla Max on it, you could just he said, I can feel this. After he was on for a few minutes, he could feel it. And then we saw color. We actually saw color. So from there, I sent him to a dear friend of mine too, who he's written a book called No More Amputations. And because this particular lady was scheduled the following day for one of the major hospitals to have her foot amputated.
And she heard about you. She wasn't going to before this, and she came over, and you were able to tell her, look, we can save this foot.
Yeah, but we've had several, so there's been several cases where people did not have to have the foot amputated. I know when I met you through a dear friend of mine, you were sharing with me there was a lot of people scheduled for amputations. I think it was in another country, though.
Well, there was one study done with the Tesla-based technology in Mexico with 87 patients scheduled for amputation, and 100% of those patients were saved from amputation.
100%. Can you believe that, guys? 100. So if you are listening to
if
the
you've
show
got someone who
has
got a wound that's not healing, anyone with a wound that's not healing, when we give 2 treatments a day, 45-minute treatments surrounded with this specialty technology that's not your father's electrostim. It's not your normal TENS.
No.
This is the world's only Tesla-based high voltage, low minimum average amperage electrostim. So we get super deep contractions with high voltage at great comfort while minimizing the pins and needles feeling that most systems, they're direct current, and all of the electrons moving in one direction create a lot of friction. This is how Tesla beat Edison in the Great Transmission Wars when the country was being electrified and the towers were being put up. Tesla found a way through his innovations to transmit the electricity in alternating current, where the electrons would move forward and back, forward and back. And he overcame the resistance of distance. If these great big power lines the size of your little finger were transmitting in direct current, they'd have to be 12 feet in diameter.
Mm-hmm.
Well, we have the same resistance issues in the body. The reason Tesla beat Edison in the Great Transmission Wars and all electricity on these giant towers is transmitted in alternating current is because he pioneered the ability to send very high voltage at very low maximum average amperage.
Mm-hmm.
So in the human body, resistance creates pins and needles feeling. And so let me give you an example. I was in Atlanta with one of our reps, and he was in a chiropractor's office who was very familiar with the electrostim. She had one of the traditional direct current muscle stimulators sitting on her shelf. And I had hooked up, like Nick Delgado, I'd hooked up this guy's triceps with 2 electrodes, front low by the elbow and up high by the armpit. And we were making his arm go straight and having him try to curl using his opposing muscle group, his biceps, and we slowly turned it up to the point where he couldn't bend his arm. It was that powerful.
Yes.
And he was laughing and giggling, saying, "This feels like I'm being tickled." Well, she said, "Heck, that's nothing. I can do that," not realizing the difference between the alternating current that has deep contractions without the pain,
right,
and her DC. She reached up on the shelf and hooked up his other arm to her standard traditional direct current system, slapped it on, and his arm ended up in such contraction, it slammed his arm straight, and he began screaming and yelling, "Take it off, take it off." Yeah, he couldn't bend his arm, but she made my case for me, and that is tolerance. We turn our system up to maximum comfortable tolerance and get the world's deepest contractions at the greatest comfort, so that someone with neuropathy in their feet caused by a sedentary lifestyle and fluid buildup, maybe they've been on diuretics and it left a honey-like sludge in their feet. The only thing that moves the lymphatic system is muscle contraction.
Muscle contraction, yes.
And so Guyton's book, Clinical Physiology, that's Med School 101, says if you don't move the lymph, you'll be dead in 24 hours. The lymphatic system is that fluid that flows around the cells.
Yes.
So what we're doing is contracting the muscles and correcting muscle strength imbalances, but we're also moving out the edema that changes the normal vacuum state in the lymph to a positive pressure that backs up through the capillaries into the arteries and creates a pressure that the heart has to beat against. When we move this edema out, we can return normal fluid dynamics and work the capillary bed, increase circulation. You got to understand that this edema, the fluid that builds up, is seawater. Some people say we had to take the terrain with us when we left the ocean. I don't know about that, but the sodium in the seawater, when it stagnates around the cells, like water in nature, any place where water stagnates, you get a fluid buildup and the water becomes toxic. Yes. In this case, you're going to see with the human body, when you have edema, the sodium in the fluid will suck the potassium out of the cells and shut off the cells one at a time, potassium sodium pump. This is how the cells work. Each cell will bring in nutrients and oxygen and glucose, and the mitochondria in the cells will use that glucose like fuel oil, and they have little refineries in the mitochondria that convert this to ATP. We create 2/3 of our body weight a day in ATP, which is the gasoline that our bodies run on, created from the glucose. And we could get really deep into this, but suffice it to say that when the edema builds up from sedentary lifestyle and you get your colorization change you mentioned, where foot will turn dark purple or black instead of the normal, beautiful, healthy color. The stories that the feet can tell are really quite and very impressively shown with infrared camera. We've actually hooked up a color mapped infrared camera.
I've seen that before, yes.
It's amazing because you can see a foot totally disappeared. Now, this is a case of edema where if you press in for 5 seconds and pull your finger away, there's a pit there.
Yeah, especially across the shin. You go right down the front side of your leg and press in with one finger. If there's an indentation, we measure that in medicine. I know in working hospitals for years, we would say +1, +2, +3 edema. And that's how they kind of look at that, how deep the finger go, and then how fast it takes to fill back up. Those are very serious, because if you're going to have poor circulation there, and we're talking about circulation, you're going to have to look at your heart, because the heart is important. You're going to have to look at the kidneys. You're going to look at the major organ system. And people who have, bilateral one foot versus both feet edema have to pay very close attention to what's going on with that edema. It could be
there's
sodium
a perfect
in the diet,
picture of
medication. Every medication that you brought up before, I always like to say Dr. Westfall, but every medication will rob you of certain nutrients. This is why at New Wellness Healthcare, we make sure that we find out the functionality of what's going on with you, what medication, your whole health, and not just isolate things. So it's a full nutritional program that's put together to help you with the whole healing. And this is why people do well. You were with me in California several years ago at the LA Convention Center, where I had a booth for 4 days. And we had people come every day for treatment. We had 2 booths. We had, about 20 machines going at one time. We treated people from sun up to sundown. And some of the people came back twice. The edema was just about gone. But the one gentleman with Bell's palsy, wasn't he incredible?
Well, in that case, we put one electrode on his palm of his hand, forcing the electricity to go through the carpal tunnel region, and that put the electricity into the nerve. The opposing electrode that communicated, we put on his face where the Bell's palsy was. So this sent the electricity up the arm through the nerves into and rejuvenated the. We got to remember, we are electrical beings. We live on a giant energy capacitor called the Earth. Within these poles, we're hit by lightning 1,000 times a second between the stratosphere and the Earth. And the polar, the solar energy actually comes in through the poles. That's where the aurora borealis is. And we've developed as a species in this electrical field. The very words I'm speaking are electrically stimulated. You're hearing via electricity. So it's actually been studied by the Biophysical Journal, did a study in which when Discover Magazine reported on it, the only thing they could say was, "Ay caramba," because they found 15 million volts of electricity that's per cubic meter of human tissue. That's basically what they found in the body, the kind of electrical energy that we run on. So this is endogenous and natural to the human system, and to use electricity to treat the cause of the pain, instead of taking the batteries out of the alarm while the fire rages, we're going to train that fire hose on the fire.
Exactly.
And put the fire out, because often the things people do for the pain, covering up the pain that damage the mucosal lining of the gut, create gut permeability, end up as a core cause for autoimmune problems where the immune system's constantly under attack, and the bloodstream is full of pathogens through this leaky gut, the permeability problem caused by pain meds. The major medical journals have written about the GI journal Gut talks about the mucosal lining being damaged by NSAIDs, and so does the American Journal of Clinical Nutrition. So this is not some, off the map.
Pocus, and and I do want to say, while we're talking about the non-steroidal anti-inflammatories like your Motrin and your all the other ones over the counter, I just want to tell people to be very, very careful. There was a couple of cases here recently where a person was taking pain medication and had really no heart problems at all. And all of a sudden, after like the 4th or 5th day, they started having cardiac arrhythmias. Now, I have a machine in my office called a Cardio Plus, Cardio Max, all the Max words here. And this machine actually will identify how many cardiac arrhythmias you've had in the last 3 minutes. This person had 50. Now, when we went back to analyze what were you taking and what were you doing, since you don't have a history of heart disease, it was the pain medication, the nonsteroidal over-the-counter, which in the PDR and on the bottle, if you Google some of these pain medicine, they will tell you they will cause heart disease and cardiac arrhythmias, including death. So I'm just saying, we pop a lot of pills, and some people will and say, well, this is just something simple that I'm taking because I have the pill. I'll take Advil. And actually, the pain medication was Advil PM. It caused the cardiac arrhythmias. So
we know that there's no drug without some kind of side effects.
Correct. Exactly.
And when we take these cocktails of drugs, we have exponential increase in the side effects, and the combinations have never been studied. It's impossible to look at all the various side effects of these new concoctions when you mix a cocktail of 20 different drugs up and what we're exposed to in our diet, etc. So when we're talking about the use of electricity in the home, in the privacy of the home, where a lady can target her deep pelvic floor muscles and strengthen them, and begin playing with the grandkids and laughing and cheering and jumping up and down and dancing and going to church and having an active lifestyle again without leaking, without having to wear Depends, you're talking about really changing people's lives for the better. Now that's correcting muscle strength imbalances and toning and strengthening muscles by targeting using the electricity, much the same way the current world strength endurance champion does to win his events.
Right. And if you want to try it out, you can always, see if this is going to work for you. And I can, this is almost something you can guarantee. You can guarantee that having one treatment, you're going to feel the benefits. You're going to feel the benefit if you have pain. You're going to feel the benefit right there. I'm the type person, I feel that God can heal the body right now. So if he puts something like this on the planet here and have it at our disposal, that you're going to feel the difference. I had a lady with a wound on the back of her heel. She was on dialysis. She had so much going on, and placed the pad on her back of her heel. I did before and after pictures. When we took the pad off, or not so much the pad, but the probe, from doing her Tesla Max treatment, you can see right then and there the wound was starting to heal. You saw granulation happening, which was phenomenal. So she said, I know this is something. It gives people hope. And when you give people hope and they know they can heal, that starts to healing even in itself, to know that there's hope for me.
We have so many videos sent in to us by providers around the country with, for example, patients who've been on chemo that trash their feet. They didn't know what they could do about it, have had huge success with the deep contractions in the privacy of their home. They come into the clinic, get a free treatment, and get introduced to the technology. And then they fall in love with it, and they realize, I'm not going to get better getting 2 or 3 treatments a week. I need 2 or 3 treatments a day for this neuropathy or this chemo-induced problem. And when people can treat their incontinence in the privacy of their home, many times they're embarrassed and ashamed. It's just a physiological problem where the muscles have atrophied, and we can target them and strengthen them without them fighting traffic, etc. They can take the technology home. We have rental programs and we have purchase programs, and where they can treat themselves on and on. They end up spending the equivalent of about a latte at Starbucks for each treatment in the privacy of their home.
And I wanted to share with you because the machine is portable, and a lot of times I would have it in my car. And not anymore, because now I'm making this public, so I don't want anybody to take it. But anyway, I would have it in my car. So we had a wonderful family reunion. And so my uncle had a stroke. And he had somebody coming out to the house, 3 times a day to give him physical therapy. So he was paralyzed on one side of his body, paraplegic, sitting in a wheelchair. And so I said, well, Uncle, let me just try this machine I have in the car. He said, well, you're always doing something and you stay up with the latest. Okay, go get it. Let's try it. So we had about 30 family members there. I hooked him up to the machine, and his arm was going up and down, up and down. The same physical therapy the lady was coming. Plus, he said it just felt good because it wasn't somebody passively doing this for him. He said, I feel like I'm in control because I can move my arm. I can move my arm, even though it's with the help of the machine contracting the right muscles. That's what's important. So he recovered so much faster with the Tesla Max versus, the physical therapy. He said, well, maybe I should not have the physical therapy. I said, well, your insurance is kind of covering that, so let them do their part. But he heals so much faster. It was just amazing. Everybody was at awe. You would have thought I brought a magic machine to the family reunion to watch him heal that way and just feel the difference. And then when we finished, his muscles even were not so flaccid, even with that one treatment for 45 minutes. It was amazing.
We've had such wonderful success with stroke patients. I have a video where a stroke patient had the stroke a year and a half ago, and she hadn't unclasped her hand in all that time. And in the very first treatment in Houston, her daughter's standing over this massage table watching her, and she begins crying as her mom opens up her hand and raises her arm above her head for the first time since the stroke. This is all on video. And the point is that the American Physical Therapy Society endorses the use of electrostim for a wide range of maladies, but they don't understand the difference between DC and Tesla, Edison and Tesla. The reason Tesla beat Edison is because he found a way to use high voltage at low amperage to overcome the resistance of distance.
Really have to stress that, because so many people come to my office, and when I put them on the machine, they'll say, "Oh no, I've had this done. I have a TENS machine." I said, "This is not the TENS. This is not a TENS machine." So if you can just put
this is a simple, it's simple to answer, doctor.
Yes.
If you look at, if you look at the output of Edison's direct current, they put out 1.39 volts for each milliamp, and it's the milliamperage that causes discomfort. So electrostim units sending out direct current are putting out 1.39 volts, which is where the deep contractions come from, for each milliamp. So when you have a system putting out 125 volts at a maximum of 90 milliamps, anytime you go beyond 10, 20, 30 milliamps, it becomes extremely uncomfortable. Feels like you're being electrocuted. People can't handle it. It's very, and you can actually cause blisters and burns that can wound people.
You know, back in the day when I was very young, very, very young, we had TENS machines at home. And my daughter, you know, she had injured her back, and I put it on her, and I'm thinking, she said, "Oh no, I don't feel it. I don't feel it." So it was a TENS, and I put it, and I thought she would never speak to me again. It was so strong. She was so uncomfortable. She was so angry with me. She said, "Mom, why would you do that to me?" You know, it's like you're
that's your direct current.
Yeah,
that's
so that
was the DC.
This was long before the Tesla Max. Yes.
Now here's the difference. The Tesla Max technology puts out up to 500 when we're talking about the comparison of voltage to amperage. We put up to 500 watts, but we never go beyond a maximum average amperage of 5 milliamps. So instead of a 1-to-1 ratio of voltage to amperage, we're putting out 100 volts for each maximum average milliamp. And that means that we have much deeper contractions while giving much greater comfort, so that people can tolerate super deep contractions. I have video of doctors hooked up at trade shows where their triceps hooked up, and they're trying with all their strength to bend their arm, and they can't. But they're not screaming in pain.
No.
They're actually amazed at the power of these contractions. And there's a lot of marketing jive and hype that says it's the magic shape of the waveform and everything else.
Yeah.
We believe that that's really marketing fraud. The only real benefits to electrostim is contractions. The deeper, the better. The longer you can tolerate it, the better. The more you can make it like real workout exercise, the better. So if you're trying to develop the abs, you don't want the DC output cheap seat systems. You want a system that's going to give you the deep contractions. Most of these people on TV advertising these little ab belts are really ripped. They have no fat. They have no adipose tissue.
Exactly.
And fat is a resistor. It will increase the pins and needles feeling. So when people get their little electrostim DC output belt, they put it on, they get all this pins and needles feeling, because resistance increases pins and needles. R equals P in the formula that we use. So since you know you're going to have, whether it's atrophied muscles or adipose tissue, bone is also a resistor. Yeah. You want to be able to get the deepest contractions at the greatest comfort. You know, and that can only be done with alternating current.
Right, because I've had a couple people that were scheduled for, one was for hip replacement surgery, and the other was several people scheduled for knee replacement surgery, and actually placing them on this type of therapy and a program, they were taken off of the schedule to have a knee replacement and a hip replacement.
Well, if you think about these chronic pain issues that cause people to not sleep at night and have muscles in contraction, that's the body saying something's wrong.
Exactly.
We always find muscle strength imbalances with knee pain. If you have a giant crane and you don't have the proper tensions on the cables that oppose each other with the crane, you're going to have a collapse of that crane. In the case of the knees, we have a series of muscles from the hamstrings to the quads to the adductors on the inside of the thighs. And when we get an imbalance there, it manifests as tensions and pressures on the knees. Meanwhile, muscles are atrophying, and you're messing up the metabolic function that creates the cushioning inside the knee. You've got to understand there's no arteries or capillaries feeding the inside of the knee. It only comes through the cartilage, the chondrocytes, through muscle activity surrounding the joint.
Exactly.
When we get muscle imbalances, we see a loss of that hyaluronic acid cushioning. So I've got doctors who do nothing but treat knees with our system. One guy up in Minnesota said, we have yet to find a knee pain patient that we can't help with your product. So whether it's knees, shoulders, hips, we're fantastic with hips. Keep in mind that we can return range of motion without the pain by getting to the core cause of the problem, not hacking at the leaves of the problem. And when you get to the cause, we tell people you should expect results. If you're not getting results and you come in to experience this technology into the clinic, then you're either placing the electrodes in the wrong place or you've misdiagnosed the problem. Let me give you an example. We had an inexperienced doctor associated with us who hooked up the electrodes on the back of the calf, the gastrocnemius, when a lady came in who'd been wearing high heels, stiletto heels, and had shortened her Achilles and had plantar fasciitis. And he made the problem worse because he was creating the muscle that was overutilized and too strong.
Yes.
He should have been treating the anterior tib muscles on the outside of the shin. And when we corrected the placement,
because people are not going to understand the muscles. I understand it. You understand it. But if you can kind of just show.
Well, the muscles that make the toes come up towards the head.
Okay.
Those are the muscles that are the extents.
I can have the Tony here, who's phenomenal, show a picture, because a picture is worth 1,000 words. So he'll show that. So a lot of times people will say they're listening, but we're going pretty fast. We're trying to get a lot in less than an hour here. And I just want to thank you so much. But he's going to kind of show that, because when you see the muscle and you say, you know what, that is that muscle. And, they might not know the name, but you're explaining everything so wonderfully. This is why I love for you to always be a guest. And I'm going to have you back for another, because it's just so much going on. And you and I both really do not like to see people suffer. So we're going to just keep going. I'm not going to stop you again.
Well, thank you. I apologize for getting into speaking the physiology in the name of different muscles.
No. We can show the muscles. That's not a problem.
If you put your hands on the outside of your shin and pull your toes up towards your head, you can feel those muscles tighten right by the shin bone on the outside of the shin bone, towards your little toes. And those are the muscles that should be used and treated to correct overuse of the gastrocnemius, or the back of the calf, which causes your toes to point down. If you point your toes down and away from you, you can feel the calf muscles tighten. Those are the muscles we use to leap. So often we'll see athletes overusing the calf muscles and not correctly creating an imbalance, if you will, with the muscles that pull the toes up towards the head. Because they're always leaping, and they end up with the pain in the foot called plantar fasciitis. And it's very easy to fix if you know what you're doing. You simply correct the muscle imbalance and the pain goes away. So if you have pain anywhere in the body, recognize that chronic pain almost always has a muscle strength imbalance associated with it. And if you know what you're doing and you have a skilled clinician involved to give you a plan of care to know where to place the electrodes, after monitoring over 1 million treatments, we know what works with these different maladies. Yes. Our protocol book has 109 pages with all kinds of applications all over the body. So if you're talking about pain, recognize pain is your friend. It's telling you something's wrong.
Exactly. There was an incident. I was actually on driving here in California on Wilshire Boulevard. Most people know that's a nice long street there. And I had stopped at a light, and a lady ran the light. And I got out to see if she was okay because she hit the side of a pole, and she looked unconscious. So I got out, called 911 quite naturally first, and got out. And then I asked her how was she doing, and she said, I'm fine. She said, my doctor told me to come on into the office because I told him my feet felt numb. I couldn't believe a doctor would say, drive yourself to the office and you have numbness in your feet. So she didn't feel the brakes at all. So that's the first thing I do when a person comes to me and they have neuropathy. You are not driving. You just can't drive. You're endangering your life and someone else. But when people don't know that, I think, if you have a friend or a loved one and they're having any problems with their feet and neuropathy and pain and don't have good feeling, and this could be from diabetes, it could be post-op from chemotherapy. That's the problem with neuropathy with chemotherapy. So there's other things that can cause that, but believe me, please don't be behind the wheel of a car.
When people have these painful conditions, they don't always start as a sharp pain where you feel like you're being stabbed by 1,000 needles.
Yes.
It starts with, I had one patient, her 74-year-old daughter, Mary, called us one day, and she said, well, we've been treating her for 30 days. She felt like she was standing on 2 inches of leather. The numbness, after 30 days, her balance has come back because her feeling, the proprioception in the bottom of the feet, your position in space and sway analysis sends a signal from the feet to the vestibular system in the brain and helps you balance. Well, she was now shopping, running around. She was moving her toes for the first time in 20 years, all because the deep contractions had moved out the edema, increased circulation. It's funny because the same week I got a call from a lady who's given us permission to use her name, Mrs. 80, in Connecticut, and she was 94 years old, and she wanted to become a sales rep with our company because she was in an assisted living center, and she said, everybody in this place needs this. I've been soaking my feet in ice at 3 o'clock in the morning for 10 years. They burn, so they hurt so bad. And now I'm sleeping through the night after 30 days of treatment in my home. 2 treatments a day, 45-minute treatments is what this took. And you just can't get that coming into the clinic 2 times a week or 3 times a week.
Right,
Many of these people are in serious trouble, and they need to participate with our take-home program so they can receive the full benefits of the treatments.
And then you're trained properly on how to do this at home, so you don't have to be afraid of anything. I'm here in California. There are doctors throughout the United States here that are doing the same thing. So you call me at 310-419-4300. And then, if you're not here in California, I will put you in contact with Mr. Greg Westfall, and we'll find you a doctor in your community.
Nationwide. And
nationwide.
We just finished in Malaysia a study with patients with the wounds down to the bone that turned out beautifully. That's a very exciting study. That'll be coming out from that society soon. But you don't have to wait. We've had patients who had numbness in the feet, which eventually turns into feeling like you're being stung by 1,000 bees at a time. But they had wounds on their legs, little scratches with their fingernail when they're putting their socks on that don't heal because they don't have proper capillary circulation.
Right.
And they report that these wounds go away just as a side benefit as they increase circulation through the deep contractions, moving out the edema, working the capillary bed, increasing circulation. They discover why even in the wisdom tree of the scriptures in Deuteronomy, it says the life of the body is the blood thereof.
Yes.
And things that inhibit circulation prevent the natural healing process of the body. So all we're doing is returning the body to normal fluid dynamics, moving out the edema that inhibits proper circulation, and letting the body heal itself.
Yeah, and I don't want to cut you off, but I just got a signal that we have like a minute left. So I know, Mr. Westfall, that you are very wordy, and you have a wealth of information. But if you can sum up something for me in a nutshell for 30 seconds, what do you want a person walking away looking into their eyes right now? 30 seconds.
I want you to expect results.
Yes.
We're going to get results. I want you to believe and hope that you can get better, because your problem is not a lack of pain meds in your system. If you're dealing with pain, this pain is your friend. Don't treat it like an enemy. Treat it as a guide that can help you get back to the core cause of the problem. When you get rid of the cause of the problem,
yes,
the pain goes away. Your pain is your friend. Change your thinking about the pain.
Wonderful. Wonderful. And you did that so nicely, and I thank you. I want to let you know, do not suffer urinary incontinence, carpal tunnel syndrome. We can start from the top of the head and go straight down. Neck pain, shoulder pain, carpal tunnel syndrome. Just don't. Back pain, scoliosis, people scheduled for an amputation. Call us. Do not suffer in silence. And you're not in silence because you're moaning in pain. So don't suffer that way. Give us a call at 310-419-4300 and let us help you. Let us help you through this journey. Your quality of life is what's important, and that's what we're here for. I want to thank you so much for being with me today. Greg Westfall, you was phenomenal. I'm glad I had a chance to see your lovely wife as well, and thank you so very much. We will be doing a part 2 with you because there's so much more to cover. But when I get ready to close the show, what do I say? So repeat after me. I am so grateful that I am a magnet for miracles. And we're eternally grateful. Every morning, every second, I want everyone, if you're not driving, hug yourself. Don't wait for someone else. You might not have a significant other. Love yourself, love on yourself, hug yourself, stay away from the sugar because that can lead to a lot of pain, and eat the right foods. God bless you, and we will see you again soon.
Join us every Wednesday live at 11 a.m. for a new Wellness TV with Dr. Lee. Remember, healthy mind, healthy body.
Thank you so much. You were wonderful. Are you there?